Hey everyone, welcome back to our channel. Today we're going to talk about what happens after a prescription is received here at our pharmacy. We get prescriptions a number of different ways. We get them through the mail, we get them electronically from other providers in the area, and we also get them over the phone. But no matter how the prescription gets to us, there are always sort of the same 6 steps that happen in order to get you your medication. First is the receiving and intake phase. During this time, we're checking that the prescription is complete and legible. For example, we need to make sure that we have the patient's name, the medication that they're wanting filled, the strength of that medication, as well as the directions from the provider. Once we have all of that information and it looks good, then we move on to step 2, which is the data entry and verification phase. During this time, we're actually going to enter all of the prescription information into our pharmacy management system. Our system will then check for any drug-to-drug interactions, any allergies that the patient might have contraindications, and it will also check to see if the patient is eligible for the medication that they're trying to get filled with their insurance. If everything checks out okay, then we move on to step 3, which is selecting and preparing the actual drug. So during this time, we're going to select the correct medication, the correct strength, and the correct dosage form. So for instance, if the doctor wrote for a tablet, but we only have it in a liquid form, we'll call the doctor and clarify before we fill it. Then once we have the correct medication, we actually have to count the pills or measure the liquid and put it into the bottle. Sometimes we even have to compound medications, which means we actually have to mix them up fresh in our back room. Once that's done, we move on to step 4, which is labeling and packaging the medication. So we actually print out a label that goes on the outside of the container. That label has the patient's name, the medication name, and strength. The directions for taking the medication, as well as our pharmacy information and any other auxiliary labels that are needed. Auxiliary labels could be things like do not crush or take with food or store in a refrigerator. After the label is printed and applied, we move on to the next step, which is final verification. During this time, a pharmacist is going to look at the medication and the label to make sure that they match and that everything is spelled correctly and the strength is what we expected it to be. Once the pharmacist verifies everything, then we move on to step 6, which is dispensing and counseling. This is when we actually hand the medication to the patient or the patient's representative, and we explain to them how to take the medication, what to expect while they're on it, as well as any potential side effects that they should watch out for. And so those are the 6 steps that happen every time a prescription is filled here at our pharmacy. If you're interested in learning more about what happens after a prescription is received here at our pharmacy, stay tuned. We've got lots of great videos coming your way. For now, I'm the clinical manager here at a pharmacy. Remember, stay safe, stay healthy, and we'll see you next time. So this is LexisRx. When we receive a new prescription, we receive it electronically. So the prescription just pops right into our system. In this case, it's for lisinopril, 10 milligrams, 1 tablet daily. The first part of the prescription process is already complete. Now we move on to data entry and verification. So I'm going to enter in the prescription. Now our system will check for any interactions with the patient's existing profile. And once that's complete, we can move on to step 3, which is selecting and preparing the actual drug. So in this case, we need to grab the lisinopril 10 milligrams tablets. And once we have those, we can move on to step 4, which is labeling and packaging the medication. Our system will automatically generate a label for us. We'll print that label and apply it to the bottle. Once the label is on the bottle, we can move on to the next step, which is final verification. During final verification, a pharmacist will look at the labeled bottle and make sure that it matches the electronic order. Once the pharmacist verifies the prescription, we can move on to the last step, which is dispensing and counseling. So I'll give the patient their medication and explain to them how to take it. And that completes the process for filling a prescription here at LexisRx.